Stress, depression, anxiety. Now, the words alone might set your nerves on edge, but these can all have a serious effect on your health.
Yeah, today, on World Mental Health Day, new research has shown that in the UK, many of us are worried about the impact of flagging up concerns at work.
What's the extent of the problem? Well, mental health problems affect a quarter of us every year. But nearly a third of people feel uncomfortable telling someone close to them about their problem.
Now, the situation is even worse in the workplace, where 37% of people fear telling their employer about illnesses such as depression or stress. A new survey also reveals that of those who'd complained of stress to their bosses, nearly a third said that they had received no help.
What's the best advice then for those who are worried about the stigma attached to mental health problems, and what should employers do to improve support? We're joined now by Annika Davidson, who's experienced some difficulties with her mental health in the workplace. Welcome. And Sean Davis, who's Director of Health and Wellbeing at Royal Mail. Good morning to you both.
Hello.
Annika, tell us what happened to you.
Well, I've had mental health problems for a number of years, and they tend to rear themselves up under times of stress or pressure. And a previous employer had a bit of stress at work, and it started to manifest itself. And long story short, I was essentially suspended for having mental health problems. Bit of an oversight on their part.
I know time's always an issue here, but I just want to dig into this a little bit more. So, did you flag up to your employer that you had mental health problems,
yes,
or you were struggling?
I've always been quite upfront and honest about my mental health problems. I think it's really important to do that, and for some reason or another, perhaps an misunderstanding on their part, they just felt that perhaps my health issues would clash with the type of work.
So they were
unsympathetic.
Yes, to what you were going through.
Okay. Do you think that exacerbated the problem?
It really did. Yeah, the whole process from start to finish. It by the end of it, I was just in absolute bits.
So, Sean, why have Royal Mail decided that this is something that needs to be addressed, and perhaps were you not dealing with it in the right way before?
So we recognise as an organisation that there is a lot that we can do, and we do genuinely value all our people. They are our biggest asset, and mental health is an issue that affects all of us, and on World Mental Health Day it's an opportunity to talk about that. We have done work in that health and wellbeing space for quite some time, but being able to single out a mental health and have a real concerted effort on that as a campaign through our Feeling First Class programme has given us an opportunity to talk about mental health, to try and do our piece our part to remove the stigma associated with mental health, and to give people confidence to talk about it.
Without negating anything that you're doing, because anything to address mental health problems or help people is obviously positive.
Yeah.
But it doesn't change the fact that someone like Annika, who's quite confident, says she's quite upfront about her mental health problems. Once you hear a story like this, you fear how your employer is going to react. And I just wonder how comfortable your employees feel about going to a line manager saying, I'm just not coping at the moment, and how much training is given to your managers to be sympathetic, how effective you can actually be.
So it's a journey. It's a journey that Royal Mail are on. What we're looking at is trying to remove that stigma, and we started by signing the Time to Change pledge, which is a visible commitment from our chief executive. The Time to Change pledge is a campaign run in conjunction with Rethink and Mind. And what we're trying to do is give people the freedom to talk about that. But I do think as a leader in an organisation, if there is a responsibility on you to talk about that, to share your own experiences. It's almost that permission giving. If you say, I've struggled, I've got personal examples of it that I've shared with people, that helps to kind of give people the confidence to share their story. Then obviously training. We've done a lot of work in conjunction with the Mental Health Foundation. We're looking at piloting mental health first aid programmes. We've got a whole range of products available through our occupational health offering.
And that's really laudable from Royal Mail's point of view, but obviously not every organisation is as big, has the resources as Royal Mail.
Yeah.
What do you think, and Annika, maybe you could chip in on this as well, what can smaller companies do? How can we help to change things with smaller organisations?
I think getting involved with your employees, speaking about it, having a more open, honest culture. If you don't understand something, have the conversation, approach someone like Mind where they have things in place, bespoke training packages that they can come in and deliver to your workforce, deliver to your managers. It's all about really making people aware of the problem, discussing how it's going to affect, not only yourself as an employee, but you as a manager as well.
And you're working for a different company now.
I am, yeah.
For the NHS now?
I work for the NHS now.
And I would hope that would be the perfect place in terms of realisation, education, knowledge to deal with someone and to help you feel comfortable in your work environment. Is that correct?
Yeah, the NHS have always been, I've worked for the NHS on and off for about 15 years or something, no, not quite that long, but I've worked for them for a long time on and off, and every time I've worked there, there's always been quite a good support system in place. They have staff support services, managers are always been very open, very approachable about problems, and I've never experienced an issue with NHS at all. They're absolutely brilliant.
Well, wish you well. Thanks so much for coming in and sharing your story with us, and Sean, thanks for telling us what Royal Mail are doing.
Time now is 12 minutes to 10. Talking about stress, depression, anxiety. The words alone could set your nerves on edge, but they can all have a serious effect on your health.
Today is World Mental Health Day, and new research has shown that many of us in the UK are worried about the impact of flagging up concerns at work.
What is the extent of the problem in our population? Mental health problems affect a quarter of us every year. But nearly a third of people feel uncomfortable about telling someone close to them about their problem.
Now, the situation is even worse in the workplace, where 37% of people fear telling their employer about illnesses such as depression or stress. A new survey also reveals that of those who had complained of stress to their bosses, nearly a third said that they had received no help.
What's the best advice then for those who are worried about the stigma attached to mental health problems, and what should employers do to improve support? Well, we're joined now by Annika Davidson, who's experienced some difficulties with her mental health in the workplace, and Sean Davis, who's Director of Health and Wellbeing at Royal Mail. Good morning to you both.
Hello.
Good morning. Annika, what happened to you? What experiences did you have?
Well, I've had mental health problems for a number of years, so it wasn't like it was a new experience for me, but in a previous job I started to become a little bit unwell due to the stress and pressures of the job, and to cut a long story short, I was essentially suspended for having mental health problems in the workplace.
But you, just to get a little bit more out of your story, you did approach your employers, I'm assuming?
Yeah, I felt that I'd been quite open and honest from the get-go, as I tend to be about my mental health, because I don't think it's anything to be ashamed of. But unfortunately they didn't see it that way, and they had concerns that perhaps my condition may impact on the ability to do the job, or impact on their consumers and clients.
Sean, Royal Mail is trying to go onto the front foot with this and deal with it and listen positively. We've had a couple of emails from Royal Mail people, a couple who've been very positive, a couple who've said that maybe in the past the company hasn't dealt with things particularly well. What are you doing differently now?
So under our umbrella programme of Feeling First Class, which is our health and wellbeing programme, we've got a dedicated strand looking specifically at mental health, and we're really committed to that part of the health and wellbeing of our employees. So through a mixture of the Feeling First Class programme, the support of our employee assistance programme.
And what does that involve? Sorry to interrupt you, but what does that, it's got a catchy name, but what does it actually involve?
So there's a number of different things we've done. So we're very active with a number of campaigns, such as the Business in the Community campaign and the Time to Change, the mental health pledge, which we signed jointly with our unions. Mental health first aiders, pilot programmes we've run in that space.
With all those programmes though and campaign names, what difference is it going to make to the employee when they go to work this week? How's it going to be different for them?
So what it does is it removes that stigma associated with mental health. It tries to normalise that, and I think that we as leaders in the organisation play a very active role in encouraging people to share their stories and to share their experiences. For example, I've deliberately shared my mental health experiences with my colleagues, so that it's almost a permission giving. Trying to normalise the mental health issues in the workplace starts with the leadership, in my view, and then it builds up this head of steam, and people really get behind that.
Annika, you said you've always been quite comfortable about talking about your mental health problems with your employers, but for anyone who isn't, and isn't perhaps fortunate enough to be in an environment such as Royal Mail is trying to create, what would you say to them when it comes to approaching their employers or other colleagues?
I think the most important thing for individuals is to be comfortable with it yourself, to understand what it is that you're suffering from. And once you've got a really good grasp on that, don't be afraid to approach your employers. Don't be afraid to speak to your colleagues.
What do you say though? Do you say I have mental health problems? Is that how you,
I think
how you start
9
that
times out of 10
conversation?
people find that they're approached first. Maybe someone will come across and say, you've not been yourself lately, and take the opportunity. If somebody's noticed it, say, you know what, I suffer from this. I've not been feeling myself lately. I do need a bit of help.
What, Sean, would you say to other businesses? I mean, Royal Mail's a big business with lots of resources, lots of room for programmes like this. Maybe smaller businesses might not have that luxury. How can they make a practical difference?
Well, there's another angle to view that from, which is that smaller companies actually have more scope. You can physically get your arms around your employee base in that sense. So I would encourage people to talk about that, share their stories, come forward and just be brave, talk about these things, and that in itself will hopefully kind of encourage more people to have conversations in that space.
And it's much like cancer was a few years ago. It was almost unspoken, wasn't
Absolutely,
it?
yeah.
Now mental health hopefully is going down that same journey.
Yeah.
Annika, Sean, thank you very much for talking to us this morning.
Thank you
Thank
very
you.
much.